Check 1 2. Hey, 1 2. Hey, hey.
To be here. Thank you for all your parishes.
We got. Check 1 2. Hey. Check 1 2. Go ahead.
Check one.
Go ahead.
Check one.
Second. Go ahead.
Good evening.
Okay. Good. Go ahead.
Good evening.
Okay. Very good.
You guys have this.
30 seconds and we'll get started, everybody. Thanks for being here.
Do we have two of those?
Do I have one?
Two of these?
Yeah.
Thank you for coming. I've used your names in both parishes.
Yeah, I'm Dan Hilker.
Dennis Spitzley.
Dennis Spitzley, I know the name. Yeah.
What's your name? Dennis.
Dennis Spitzley.
Nice to meet you,
Yeah.
Joanne.
Father Andrew can't be here. I'm a senior priest, 6 years retired. Our intentions with it.
Thank you for being here.
We'll get a chance to chat with you.
All right, good.
Thank you. Okay. Great.
Thank you. Let's keep this copy. I have it already. This one.
I promised 30 seconds, but our host has other intentions, it seems. I don't know. Yeah. Coming back. He's got that all set up. Trying to whisper here, but they've got me mic'd.
Hello, I'm Jim Collegia, and welcome to St. John's, first of our two town hall meetings regarding the Michigan Proposal 3 that will be on the November 8th ballot. I'm glad you have interest in this proposal, or else you wouldn't be here. Since we are in a place of worship, I would like to introduce you to Lori Pellerman. She'll come up and say a short prayer before we begin.
Thank you, Jim. There are prayer cards in the pews. We're going to pray this prayer, and we're going to storm heaven with our prayers as we fight like heaven. Almighty, ever-living God, you bestow the gift of life as you form each of us in our mother's womb. Look on our nation, state, and community and awaken in every heart reverence for life. Protect our state from unjust laws. In your name, bring to defeat every attack against the sacredness of life. Safeguard the rights of parents whom you have entrusted with the care and formation of their children. Help all who believe in Jesus to proclaim the gospel of life to their neighbors. Dispel every anxiety and fear. Strengthen the bond between parents and their unborn child. May mothers and fathers accept and nurture the gift of life made in your image and likeness. Our Lady, Queen of the Family, pray for us. Saint Michael the Archangel, pray for us. Saint Joseph, protector of the unborn, pray for us. Thank you again for coming, and enjoy our very dynamic and wonderful speakers.
Thanks, Lori. I want to start off that this meeting is not to try to turn anyone into a Catholic. I don't know if we have some people here who heard it through different live streams and other sources. If you want to turn into a Catholic, there's folks here that'll help you. But this meeting is not even that much about abortion, whether you're pro-life, pro-abortion, or pro-choice. This meeting is to go over Proposal 3. There's a lot of questions. There's a lot of misunderstandings with it, and that's what we want to get out so that you are comfortable going out to your friends, families, other parishioners, co-workers, and talking to them in a civil manner. We want to keep this very civil. So with that being said, we are, again, not trying to change any of your beliefs on abortion. We're trying to educate you on Proposal 3. Our guest panel consists of Joanne Castillo, MD, right here, and her attorney husband, Daniel Hiker. They traveled from the other side of Lansing to be here, and I'm going to tease them a little bit because I'm going to read their bio because I just got it. They're very busy people. So, okay, Joanne's bio. Dr. Joanne E. Castillo was born and raised in Ponce, Puerto Rico. She is a board-certified family medicine physician and has been practicing medicine for over 12 years. Her interests include caring for patients of all ages and families, preventative medicine, and incorporating natural family planning primarily through the Cretan model fertility care system with features of, and I'm not sure what, NAPRO. You can explain that later. Technology. She is interested in comprehensive wellness and partnering with her patients to be happy, holy, and healthy. Dr. Castillo enjoys reading, dancing, and spending time with her husband and their children, families, and friends. And the two little cute kids that were back there, that's theirs. So Dan's bio is Daniel S. Hilker. Okay. Was born and raised in Michigan. He graduated from Michigan State University. We won't hold that against you, but that's okay. From Michigan State University College of Law with honors, Daniel focuses his practice in the areas of probate litigation, estate and trust administration, elder law, and estate planning. Daniel serves on several committees and council roles, including council member for the probate and estate planning section of the State Bar, and chair of the Legislation Analysis and Monitoring Committee, and member of the Legislation Development Drafting Committee. He's a member of the County Bar, Ingham County Bar, member of the Greater Lansing Estate Planning Council. He is recognized by his peers and was selected to Rising Stars for 2019 and 2022 by Super Lawyers Magazine. So why don't we just give them a little round of applause for coming this far. Thanks, guys. So what we're going to do, the night will proceed with us going through, there's two parts to the proposal. There's going to be what is on the ballot, and then what's actually in the proposal. So right out of the gate, you will see on these monitors and on your front page, everybody should have this document. Does everybody have this? Who doesn't? And our ushers will pass some more out to you. Does anybody not have this? We've got a couple people over here. So one of the very first problems, I guess you want to call it, is what people are going to see on the ballot is only 95 words, whereas the entire proposal is more closer to 350 words. So a person's going to miss out on a lot of verbiage and not know if they don't investigate this. This is why we're having town hall meetings, so hopefully you guys can go out and spread the word that, hey, there's a lot more to this. After what we're going to do is go through the proposals, and I'm going to read certain parts, and then our experts are going to kind of be the rebuttal as to why this is in the legal world, in the medical field. So I'm just the dumb guy up here. They're the smart people. And we'll go through this, and then in your packet, there's some little cards, white cards, and pencils and pens in the pews. Those are for writing down questions. So as we go through it, you get a question, write it down. Ushers will come by periodically with some baskets, and you can toss your card into the basket, and we'll bring them up here. After we go through the proposal, they'll do another collection of them, and at that time, we'll invite April Snyder up to talk about if you've already voted, maybe absentee, there is a way to spoil your ballot. And she's going to talk about how you can do that. So if after this, you're sitting there saying, oh, I chose this, I want to change it, you can. You're not done, okay? After that, there will be a few remarks, and we have a really good video for you. And then we'll have some closing remarks. We hope to get you out of here by an hour and 15 minutes. Any questions before we get started? Fantastic. So, you can either follow along. The very first page we're going to go has the State of Michigan Bureau of Elections Lansing on the very top with the Michigan logo. And we'll go through that first. Again, this is what you'll see on the ballot. It says a proposal to amend the state constitution to establish a new individual right to reproductive freedom, including right to make all decisions about pregnancy and abortion, allow state to regulate abortion in some cases, and forbid prosecution of individuals exercising established right. The proposed constitutional amendment would establish a new individual right to reproductive freedom, including right to make and carry out all decisions about pregnancy, such as prenatal care, childbirth, postpartum care, contraception, sterilization, abortion, miscarriage management, and infertility. I'm going kind of fast through this because you guys can read. Allow state to regulate abortion after fetal viability, but not prohibit if medically needed to protect a patient's life or physical or mental health. Forbid state discrimination in enforcement of this right. Prohibit prosecution of an individual or a person helping a pregnant individual for exercising rights established by this amendment, and then invalidate state laws conflicting with this amendment. Should this proposal be adopted, yes or no? No. Okay, that is what you will see on November 8th. Okay, so let's turn the page. If you notice too, on that very bottom there, 3/4 of the way down, the word count is 95. So this next page where it says, where does it say that? This is the entire proposal, which again is about 340 words. We're going to go paragraph by paragraph, and you'll see little footnotes like number 1, number 2, number 3 in each of the paragraphs. Does everybody follow? Everybody good? Good. When we get to those, after we go through the first paragraph, our guests will field some concerns about those, some rebuttals to those, which some of them on the next page, there's a shortened version, and they'll work with that along with their expertise to explain what those things and what those issues are. Okay? You can follow along up here. If you don't want to keep looking down here, this page will be on the monitors here and over there in the back, and on the ones in the corners. Okay? So, let's get started. In the entire proposal, the first section says, every individual has a fundamental right to reproductive freedom, which entails the right to make and effectuate decisions about all matters relating to pregnancy, including, but not limited to, prenatal care, childbirth, postpartum care, contraception, sterilization, abortion care, miscarriage management, and infertility care. So we have some footnotes there. So, Joanne, do you want to address the term individual, or would you?
That's probably more my department.
Then you guys decide.
Yeah, so number 1 relates significantly to number 7, but let's talk first about where this front page language came from. How does this get produced? Who writes it? Where does it come from? So it's in the Constitution of the state of Michigan that only 100 words can appear in our ballots. That's because there used to be, concerns about printing and how long the ballots are, et cetera, and so they can only put 100 words on the ballot. That is a limitation in how much content you can cram into 100 words, okay? So if this does pass, that's an argument in the future that somebody might make. Say, hey, this whole thing is unconstitutional because you couldn't fit all this stuff in 100 words. But they certainly tried. But it's important to remember who wrote it, okay? This was written by Planned Parenthood and the ACLU, this front page, okay? It was then approved, rubber stamped, by one of Gretchen Whitmer's appointees. So it's not something written by a legal scholar. It's not something written by somebody who's on the side of life, all right? So we have to look for discrepancies between the front and the actual content. One of the things I like to tell people that many of you may never have heard is that when they sent this text around to get signatures from people, there's the front page, and it has this little blurb at the top, okay? And then it's got a signature section. And then it's got this tiny print at the bottom that says, if you want to know more, read the back. You flip over to the back, and then it would have this text followed by more than 2,000, yeah, is that the one?
Yeah.
Yeah, so followed by more than 2,000 words that would be altered or abrogated in our Michigan Constitution. Yeah, you may not have seen the 2,000 words that have been altered or abrogated in our Michigan Constitution, but that's what the ACLU and Planned Parenthood think is going to be changed in the Michigan Constitution, okay? Among the things that they think are going to be changed, my personal favorite is within the section on human embryo and embryonic stem cell research, and it says, no person may, for valuable consideration, purchase or sell human embryos.
They're getting rid of that section.
So that section is being altered or abrogated in the Michigan Constitution, along with 2,000 other words, okay? So this proposal, and that's from them, so that's what they acknowledge, we are doing this to the Michigan Constitution, all right? Now, our role is to fight the billboards, is to fight the YouTube ads.
The lies.
That are flat lies, okay? So what's in here, what's in the text of the alter and abrogate section, that's true, that's real, that's happening, okay? What's on the billboards is return to Roe, right? Protect women, protect the right to abortion. Well, yeah, I mean, we're going to return to Roe in a certain sense, insofar as we're going to pass it as a mile marker on the way to oblivion. Okay, if this passes, this is the most radical abortion proposal in the country and in the world, except for China and North Korea. Okay. This is very serious. If you have never been involved in pro-life ministry before, if you've never knocked on a door before, if you've never talked to a neighbor before, just know that this is the last stop on the bullet train, okay? If we stop it, there's going to be a lot more fights. There's going to be a lot more battles. There's going to be a lot more legislative issues. But if we don't stop it, this is over, okay? At least for 2 years, if you can get another amendment campaign together and overturn it. But that's 2 years of absolute madness. Okay? So, individual, now that we've covered those issues.
Legally in Michigan, individual means?
Yeah, legally in Michigan, individual means a living, breathing person. Okay?
Not an institution.
Whereas
or organization.
person is used for organizations as well as individuals. It's important to relate number 1 with number 7, which is labeled as number 2 in the article. So the state shall not discriminate. All right? So if you just Google search for under Michigan laws for shall not discriminate, you'll come up with a whole plethora of things. But it will always be followed by a secondary clause. The state shall not discriminate with regard to sex, age, race, gender, or in certain statutes, it says just sex. Certain statutes, it says just age. Certain statutes, it says a whole list of things, many more than what I just listed. This says nothing. Why is that important? It means shall not discriminate, period, full stop. I don't care what the secondary clause is. You shall not discriminate, period.
Under any circumstance.
Under any circumstances, including minority. All right? So where does it say that minors are going to be involved here? Individual and shall not discriminate. Okay? So fundamental right. All right? Let's not get too deep into the legal weeds, but the other fundamental rights you have, life, liberty, speech, right? Certain rights, like speech, can be restricted. Time, place, and manner restrictions. I can't, yell in a crowded church that the building it's not doing this, but I can't yell that the building's burning down because it causes panic and can cause people to die, right? My free speech is restricted in that particular way, all right? So what this does is it says each individual has a fundamental right, and instead of just leaving at fundamental right to abortion and allowing the Supreme Court and allowing the other courts in Michigan to flesh out over the course of years and over the course of cases, well, time, place, and manner for abortion, okay, we restrict this here, we restrict this here. It is making this as broad as it possibly can, all right? They could have done this in one paragraph, but they did it in 5, and they did it in 5 for the reason that they want as few restrictions as possible on their business model. Keep in mind that this was written by a business.
That wants abortion on demand, anywhere to anyone at any time.
Okay? And they want it to happen in their facilities in an unrestricted way. They want it to happen in their facilities without government oversight, without government monitoring. The little, pithy example that I usually give to people is you wouldn't give McDonald's carte blanche authority to rewrite the regulations on beef in Michigan. Don't give Planned Parenthood carte blanche authority to rewrite the regulations on abortion in Michigan, okay? Even if you are talking to somebody who is in favor of abortion, this is not the way to go about it. This is not the way to protect women's rights as patients in that setting. So you'll see from your notes in the back here, number 1, they talk about individual, making it broadly applicable to children.
Male,
right?
female, minor, or adult.
Right? The specific concern with that is that they are allowing children to have a fundamental right to abortion which cannot be restricted by the state. They are giving children a fundamental right to sterilization, which cannot be restricted by the state. And additionally, they're giving ultimate protection to anyone who aids or assists them and who participates in the actual procedure.
So
Let me walk you through that, okay? So 3 steps. 1, the individual has the right. 2, the person that takes my child to the facility is protected. Think of school counselor.
Or a family member.
Think of your crazy, family member that is all for transgender rights. And then 3, the abortion provider or sterilization provider is also protected, and we think it's a protection from malpractice claims as well as a protection from state regulation, okay? The reason that's important is if they botch the job and they kill my child, I can't sue them in malpractice. If they botch the job and they kill my child, I can't press criminal charges. okay?
If it was under voluntary consent by the patient.
Right. And that's an important detail. Joanne, why don't you talk about voluntary and
We can get there later.
it's okay. You brought it up. Go for it.
It's section 3, number 8, where it says, nor shall the state penalize, prosecute, or otherwise take adverse action against someone for aiding or assisting a pregnant individual in exercising their right to reproductive freedom with their voluntary consent. So voluntary consent means that they're not being coerced or pressured by someone else. To a certain extent, right? Like they are saying, yes, I agree to have this procedure done, but it's not the same as informed consent, which is what we talk about in any healthcare facility. Any healthcare provider, when you are going to take a medication or you're going to do a surgery or a treatment or you're going to be participating in a research study, you need to be informed of the risks and benefits before you make a decision of taking a medication or going through surgery or participating in a research project or a study. So instead of the patient required to have an informed consent, they will only need to provide voluntary consent. And one of the things that now it's in place since Roe versus Wade was established or decided in 1973, a lot of laws have been put in place over the years and they're going to be invalidated by this. And one of them is that a patient needs to be informed at least 24 hours before having abortion. So they could go to an abortion clinic, but they need to be informed about their options and their risk and what is going to be taking place. And they need 24 hours from that moment to have an abortion, if they decide to do that. But with this, they're not going to have to wait. You're just going to be able to go and get it done and get it done now. And it will also mean that the patient could be taken by someone that is not a parent, like someone that is an abuser. Talking about human trafficking or patients that are suffering from abuse, they're not going to need the parental consent. So the abuser could potentially take the minor to have an abortion without parental consent, and the parent cannot prosecute that person for the abortion. They could be prosecuted for sexual abuse if they find out, but not for the abortion itself. So it is very serious and concerning.
I have a question in regards to that first paragraph. A couple people have brought this up to me, and maybe it seems somewhat clear, but the term sterilization, I've had people say, well, that does not mean gender reassignment. And can you speak to that?
Yes. So sterilization can happen through surgery. For women, could be tubal ligations, how they describe it when they cut the fallopian tubes. Nowadays, the more common practice is to actually remove them. In the past, women will have their fallopian tubes removed, and you could actually reconnect them, and they will regret it and reverse the surgery and reestablish fertility. Now they're taking them out because they think ovarian cancer starts in the fallopian tube. The other procedure that they do, or they had been doing for years, is coils in the fallopian tubes, which are now not allowed because a lot of women got hurt or injured through the procedure. And the other option is for men to have a vasectomy, which is cutting the vas deferens where the sperm goes through. There is a potential for reversal for vasectomies. Some urologists do them, so there is still potential to reverse it if someone regrets it. But when a child is given hormones of the opposite gender, the hormones cause atrophy of the reproductive organs. So let's say, for example, you have a boy and you're going to give them medication to decrease the androgen levels, like testosterone, hormones that are going to promote the development of a man, and you start giving them estrogen. And you give them for a long enough time, years of treatment, until they become adult. And over time, you're going to cause permanent damage to the testicular tissue and to the prostate gland. And it's going to be irreversible. So if the patient decides to stop the treatment because they regret it, they don't want to continue through, there's going to be damage already done depending on how long they have been on the hormones of the opposite gender. And it's going to cause atrophy. So maybe they stop it in the middle of the process. Maybe they'll still be able to produce some sperm, but maybe it's going to be low quality, low motility, maybe won't be good enough to be able to conceive in the future. And so the current recommendation for patients that are considering gender reassignment treatment or surgery is to freeze ovarian tissue and testicular tissue in case they want to use it in the future for procreation, which will actually be required to use in vitro fertilization, which is by itself an unethical medical practice. And I can talk about that for like an hour, why IVF is unethical. But we're talking about cost of freezing tissue and cost of treatment in the future if they will want to have children. And we're talking about treatment for hormonal therapy that could be started as early as age 12. So these are recommendations that come from the Endocrine Society, and you can look them up. These are pediatric endocrinologists that are going to be able to provide hormonal treatment to minors. And they're doing it. You can look up research from United Kingdom. They have been doing it for years, and they have common medical care for everyone, so they have a lot of research behind this. You can start as early as age 12, and you can give hormonal pubertal blockage, basically to allow the child to have time to decide which gender they want to continue going through puberty. If they decide to do hormonal therapy of the opposite gender, they can actually have surgery to have a gender transition after 1 year of hormonal therapy. So we're talking about...
Interrupt you, but
No, that's okay.
to what you said is a counselor or a teacher or someone outside of the family could help that child, and there'd be no chance to prosecute that person. Is that correct?
That is correct.
Correct. And furthermore, you as a parent, if you find out about it, don't have the right to interfere.
Yeah.
Your child has a fundamental right to proceed with this procedure, with this treatment, and the school, the state, okay, the state of Michigan has an obligation to protect their fundamental right from you
Yeah.
as a parent, okay? In the same way as if they were protecting them from child abuse.
Yeah.
Okay? This is you talk about state overreach. This is insane, right?
Yeah.
So to his point, you want
Just to wrap up, so most gender therapy is usually done around age 14 to 16, so it's not done as early as age 12, even though it's possible to start treatment at that age. What we are seeing, and depending on what studies you look at, some studies are skewed depending on who makes them. So if you have a study that says start treatment age 13, and then they recheck in 5 years, and they're 18, they're still okay with their gender transition, they may not be okay 10, 20 years after that. I mean, I've seen countless of women that have been sterilized and 10, 15 years after regret it and they want to have more children. So we're talking about children that don't have the capacity to understand the severity of the consequences of these treatments at this age. And to be able to take a medication that is going to make them infertile for the rest of their life, that is so self-destructive and so self-mutilating, it's absurd. So we have to do something now, and we have to talk about this and understand that when they say sterilization, it includes the sterilization of minors through hormonal therapy that would happen over time. And the other thing is that the treatment right now as Catholic physician is to observe and to provide counseling, because over time what they see is that the patient goes back to their normal self, meaning they're starting to see that there's some underlying trauma or abuse or maybe undiagnosed autism disorder, that it's the underlying problem to the search for this transgender therapy. And they're comparing it to people that have an eating disorder. So let's say a girl that has had some trauma or abuse, and they start controlling their eating in a way that causes a disorder like anorexia or bulimia will be, and they're comparing it to the transgender culture. And there's also studies about how they have not been able to find a genetic link with people having feelings of attraction to someone from the same gender. In twin studies, they have been able to see that it's mostly based on the culture and the environment where the twin is. And so we have to keep that in mind as well, because our culture is really promoting this from a very early age, especially in the public system, in public schools.
So let me before you jump to your next one, let me wrap that in quick. So it's a fundamental right about all matters relating to pregnancy, including sterilization, but not limited to, okay?
Thank you.
But not limited to is an important clause there, because it's saying, these are some examples of the things we're talking about, all right? when you say sterilization, yeah, you're also talking about hormonal sterilization, right? When you say relating to pregnancy, well, you know what? Changing your anatomy is relating to pregnancy because we're talking about the reproductive anatomy, all right? One of the things you know, some of the women in the crowd might think this is crass, and forgive me, Lord, but, you know, I've been a 14-year-old boy before, right? And I've met a lot of 14-year-old boys, and I would not put it past any of us to run off and get sterilized.
So we could see young men getting vasectomies.
Transgender is a total different thing, but like just the football team, yeah,
Free for
okay,
all.
we're gonna all go get a tattoo this weekend as 18-year-olds is not that far different from, yeah, we're all gonna go get sterilized this weekend because, you know, we don't wanna get pregnant in high school. Right? It's just a mindset that we try as Catholics to avoid in our children, but we are in a very, very oppressive culture at the moment. So
Okay.
anyway, let's keep
I'm going
moving.
to move us on.
Go ahead.
And one thing that I would point out, sorry, is that minors right now can receive care for pregnancy and contraception without parental consent. Right now, minors can receive contraception and pregnancy care without parental consent.
But not abortion.
But not abortion. They can also receive care for sexually transmitted disease infections, screening and treatment, and substance abuse. That's why clinics like Planned Parenthood exist. They may not want their parents to know in their health insurance there was a bill for sexually transmitted disease infection, so they go to a clinic where they can have it done without anyone knowing about it. And so you have to keep in mind that everything else right now, it's available. The only new thing that they're trying to push here is the abortion and the sterilization, because miscarriage care is another one. Miscarriage is like a baby dies in utero spontaneously. So it's a pregnancy that did not progress naturally. And so where is the woman gonna go? To their OBGYN, and how they're gonna address it? Well, depending on the numbers of weeks, they can wait for the baby to pass, they can give a medication, or they can do a dilation and curettage to get the baby out. But this is something that is already being provided that we don't need to have in the Constitution. So really the only new thing is sterilization and abortion.
Nicely said. Okay, so we're going to move on. There's another part that there's some questions on, and it's where the number 4 footnote, the particular part, it says that individuals' right to reproductive freedom shall not be denied, burdened, or nor infringed upon unless justified by compelling state interest achieved by the least restrictive means. I've had several people ask me, upon unless justified by compelling state interest achieved by the least restrictive means, what does that mean?
All right, so this is, I'm not going to dig too deep into constitutional law on you guys, all right? But just, this is as crazy as you can imagine, all right? If you can imagine it being absolutely off the wall nuts. When I read this just as a legal professional, Section 1, Paragraph 2, and Section 4, Paragraph 1, combining the two of those, I looked at that and looked at that and looked at that, and I thought, you know what? This really is the craziest thing I've ever read. Hands down. Not even setting aside the abortion issue, setting aside the sterilization issue, just as a law, this is the craziest thing I've ever read. Let me walk you through it. All right.
It's not a law, right? It's an amendment to the Constitution.
Well,
Okay.
it's an amendment to the Constitution, the foundation of our laws. It's a law in that sense. So, So, paragraph 2 of section 1 is allegedly modified by paragraph 3, okay? So paragraph 2 is talking about pre-viability. Paragraph 3 is talking about post-viability. You'll note from section 4 that fetal viability is going to be determined by the physician, by the medical professional, by the social worker at the facility. But
Before you go any further, can you explain what fetal viability is?
I'm not going to do that yet because
let him do that first.
I'm focused on
Then I can do the fetal
I'm
viability.
focused on compelling state interest. Okay. Typically, compelling state interests. Let me give you an example. So, you have the right to free speech, right? But if you work for the CIA or you happen to be a reporter that's got a lead in the CIA and they know about this special mission to Pakistan to kill Osama bin Laden and you're going to publish it on the front page of the New York Times, the US government has a compelling state interest to prevent you from doing that, to prevent you from speaking, and they can prevent you from speaking, all right? They can cut your paper, they can militarize and take over your business momentarily, right? But it's a compelling state interest because it's such a radical situation. So loose lips sink ships, right? You remember that. All of that is involved in the concept of limitation on our fundamental right to free speech. What they do here is they change the normal legal definition of compelling state interest, and they change it in Section 4, all right? They say that pre-viability, a woman's right to have an abortion, cannot be denied unless it's a compelling state interest. What does that mean? Has to be for the limited purpose of protecting the health of the individual seeking care. Okay. Has to be consistent with accepted clinical standards of practice and evidence-based medicine. And 3, the crazy one, does not infringe on that individual's autonomous decision-making. So let's start with the crazy one. Speed limits infringe on your autonomous decision-making. Every single law in the books infringes on your autonomous decision-making. What they are saying here is no law, no where, no how can regulate abortion. That's how I read it. That's how the scholars that I've talked to read it, okay? Back up, all right? Consistent with clinical standards of practice and evidence-based medicine. Who are the primary practitioners of pre-viability abortions? Overwhelmingly, Planned Parenthood. Overwhelmingly, right? They are the ones that set the clinical standards of care, right? So they're saying, you can write a law, sure, no problem, but it has to comply with our clinical standards of care, okay? Now the first one, for the limited purpose of protecting the health of an individual seeking care, that is, the woman. The state can have no other purpose and no other interest other than protecting the woman seeking care. What does that mean? Well, obviously no father's rights, right? But we don't have that now. So if the state were to create a law that said, well, fathers have to be informed before a pre-viability abortion, absolutely no way, right? I think minors plays into this, right? You can't write a law that says the minor's parents have to be informed. Why? Well, because that's not for the limited purpose of protecting the health of an individual seeking care. It's just not. It's not for the health of the individual seeking care, right? Again, that plays into minors and pre-viability abortion. Also, you can't create a pain statute, okay? For instance, okay, you can have an abortion, but you have to euthanize the child in utero. You have to administer pain, what do we call pain eliminating drugs?
Narcotics, pain medication?
Any kind of narcotic pain medication to the infant in utero before you cut it up, right? So it doesn't feel what it's going through. We do that for dogs, right? No veterinarian in Michigan is allowed to euthanize an animal by shooting it.
without anesthesia.
right? You have to administer anesthetic, okay? But we don't have that law for this living, feeling being in the womb. So I think that is more than enough to say that, that in number 4, compelling state interest in a typical sense means something very, very different than what it means here in this amendment. In this amendment is the craziest thing I've ever seen.
Okay, great. I want to go back to my one little question, and that's, you used it several times, fetal viability.
Sure. So let me give Joanne's going to give the medical side of what viability means, but I wanted to show you where that applies in this statute. So it's the distinction between Section 1, Paragraph 2, and Section 1, Paragraph 3, okay? So it's saying, notwithstanding, the state may regulate abortion after viability, okay?
Where are you now? Sorry.
Right here.
Okay.
So
The third
it's saying
paragraph,
that
Section 1.
everything I just told you about compelling interest and the state laws, not infringing, that won't apply post-viability, meaning we'll talk about what viability means. But I want to point out 2 critical caveats, all right? That even post-viability, when the state is enacting its laws, it cannot, under any circumstances, no way, no how, regulate in such a way that it prevents an abortion that is medically indicated to protect the life or physical health or mental health of the pregnant individual.
Not the pregnant woman. Even though I haven't met a man that is pregnant yet.
Okay, but right now in Michigan, you can have an abortion up to term. You can have an abortion up to term in Michigan right now when it is about to kill the mother, okay? When the medical professional says, you know what? Your life is at risk. You're about to die. We don't require, as Catholics, you to be, St. Gianna Molla, right? You can terminate. That's acceptable. You're not choosing to kill your child. You're choosing to protect your own life from this medical eventuality, all right? Protecting the life of the mother is enshrined in our Michigan laws. What's not is the physical health of the mother. So at 8.5 months, the physical health of the mother can be a reason to terminate the pregnancy.
Anyone that has been pregnant has had back pain, has been uncomfortable at the end, can't sleep, joints hurt, swollen legs, swollen everything, right?
Right, and
Not in all pregnancies,
but
it can
even in a normal pregnancy going through with labor, you can have bleeding, you can have tears, you can have major complications. And okay, the only way we think we're going to get this baby out is a cesarean. I don't want a cesarean. That's infringing on my physical health. Kill the child. Right? That's really in here. I'm not making it up. Those are the words. The last one I want to point out is mental health, right? I'm anxious about my pregnancy. That's a reason to terminate at 8 months. Okay, the baby's kicking, the baby's moving around. That's a real quickened life. Can terminate at 8 months. But, all right, so now you know the distinction between Section 1, Paragraph 2, and Paragraph 3. What can the state do pre-viability and post-viability? But what does viability mean? In the real world, and in the crazy Prop 3 world, they mean fundamentally different things.
So viable means capable of living. That's what viable means, capable of living. Scientifically, it's a fact that life begins at conception. This is not just a church's teaching. There is science behind that life begins at the moment of conception. When the egg and the sperm meet, a zygote is formed, all the genetic information is there. It's the single most important human cell that exists, because from this cell, stem cells produce all the layers that are going to form all the organs of the baby are going to come from this one single cell. It's the most important, single most important human cell is the zygote, and it's alive. It's a cell that is alive. If this cell wouldn't be alive, I mean, it's not a tumor, but it's growing, right? It is a human being that is alive in its most simple form. It's a Homo sapiens sapiens. That is the species, right? Because, like Venerable Fulton Sheen said, lilies make lilies, elephant make elephants. Human beings make human beings, okay? That's what is there living. And when we talk in the medical world about being alive, I mean, this goes back to, like, if you want to look up studies about this, I'm talking about JAMA in like 1887 is talking about life starting at the moment of fertilization. This is not new science. This is going back decades, centuries, okay? Life begins at the moment of conception. It's a scientific fact. It's in hundreds of biology books. We talk about fetal viability inside the woman's body, intracorporeous, and we talk about fetal viability extracorporeous, outside of the womb. So we have to keep this concept in mind, that is the science behind the life of the baby. When you talk to someone that does IVF, they talk about viable embryos, right? Some embryos they consider viable and some not viable, and they discard the ones that they think are not viable. But they're all alive. They may not be dividing the way they wanted to up to 14 days, and so they might get rid of them. This is another topic that I could talk about for an hour, and why in vitro is so horrible, and why we lose so many lives besides abortion through in vitro treatments, but that's a different story. And so when we talk about fetal viability, the way Roe described fetal viability is when there was meaningful life. That's how Roe versus Wade defined fetal viability. At the point when there's meaningful life, all life is meaningful. All life is meaningful from the moment of conception. They said that the fetus will be viable when they can survive outside of the womb. In 1973, it was 28 weeks. And nowadays, with science and treatments, a baby that is born at 21 weeks can survive with neonatal intensive care unit care, right? We have the staff available, not just parental care, but also medical staff that can provide that care, and that baby can survive. But it's called extraordinary medical care, right? It's not the normal care. Any baby, even a baby born at term, 39 weeks, 40 weeks, could require intensive care. Any baby. Baby can have problems at the moment of birth. Maybe they have trouble breathing. Maybe their blood sugar dropped. They may be for a week in the NICU, even if they're at term. I mean, any baby could require extraordinary medical care. So when they talk about fetal viability,
This is in section 4, first paragraph.
this is crazy.
Second paragraph.
Because a baby can survive 21 weeks or more, even though abortions are here in Michigan even up to 23 weeks in some abortion clinics, with NICU, right, with intensive care. The baby's gonna depend on the mother before that to leave, but the baby is alive and is breathing through the mom. The baby may need medical care to breathe outside of the womb at that time, right? But the baby is gonna be able to survive with that care. According to this, fetal viability means the point in pregnancy when, in the professional judgment of an attending healthcare professional, not a physician, and based on the particular facts of the case, who knows what that means, there is a significant likelihood of the fetus's sustained survival outside of the uterus without the application of extraordinary medical measures, which means a premature baby could be left to die. 36-year-old baby could be left to die, because this baby will need extraordinary medical measures. It could be that a woman that has preeclampsia, her blood pressure is 200/100, and she's 25 weeks pregnant, and she's not sure if she wants to have the baby yet, and she needs to deliver the baby because that's the treatment for preeclampsia. Her blood pressure is so high she could have a stroke or a heart attack, she could die, and the only treatment is to take the baby out. So if she's not going to have an emergency C-section, they're going to have to deliver the baby. And if she doesn't want to have the baby or she's not sure, they don't have to provide this extraordinary medical care to the baby. They can leave the baby to die. That's what this means.
So the baby out of the womb and, you know, exposing the child to the elements and letting the child die, that particular point is advocated by some legal scholars who are anti-Prop 3, not advocated by me, personally. I think that woman in that situation with preeclampsia, she's 25 weeks, she can terminate at that point because because that child would require extraordinary measures out of the womb. So terminate in utero, end of story, you're done. So it's the reason, to the point of the question, which we're getting around to, is why is it so hard to prosecute? Okay? Prosecutors absolutely require clear, well-defined laws. You can do this, but you can't do that. Okay? You know, there's a difference between robbery and breaking and entering. There's a difference between assault and aggravated assault. There's a difference between assault, aggravated assault, and assault with a deadly weapon. All of these things carry radically different penalties associated with them. I don't do that kind of law. I don't know that much about it. I studied it some, okay? The reason that this is so difficult is that if a prosecutor is trying to enforce a law that is based on this text, that is trying to comply with this text, they have to defer to the perpetrator's definitions of the law. Okay? How does that play out? So you have Kermit Gosnell, right? Well-known, terrible doctor who did awful things regarding abortion. Killed women, killed many, many hundreds of children after viability. Okay? All he has to do to avoid the post-viability charge is say, well, no, in my medical professional judgment, I determined that those were non-viable fetuses, and therefore I terminated them at 39 weeks. And what it says here, the state shall not penalize, prosecute, or otherwise take adverse action against someone for aiding or assisting a pregnant individual in exercising the right to reproductive freedom. Period. You cannot prosecute that person because in their professional judgment, they made a fetal viability determination. You can't question it. Okay.
Great job. And if you've noticed, and I like this format better, this is our first town hall meeting, so we hadn't done one before, and we figured we'd go step by step through that document. I like how you both have mixed them all together. Hey, go here. Hey, go here. So you hit on a lot of the whole thing. Now, there is a couple questions.
There's a lot more. Did we get questions from the audience?
Well, wait 1 second. I want to remind everybody that you have a card in your pew to take down your questions. There's going to be ushers that are going to come around. We have some questions regarding some of the things you talked about already that
Go ahead.
came in before.
We're ready.
So, one of them is, and you kind of hit on this, but in paragraph 3, there's another one of those including but not limited to. And there's also one of those up in paragraph 1.
Sure.
So is it the same? Is it the same what you talked about before? No one knows exactly what the limitations could or would be?
So he's referring to the including but not limited to clause in section 1, paragraph 1, and in section 3. What does including but not limited to mean? It means...
Blank check.
Not exactly. So the way that's construed legally is under the principle of justem generis, right? Funny Latin term, means like things, all right? So if you have a list, bicycles, tricycles, mopeds, motorcycles, okay? You're also, and it says, but, including but not limited to bicycles, tricycles, mopeds, motorcycles. You're also going to include motor trikes. That would fall under that law, right? So things that are of the same kind, similar to, they are including but not limited to, okay? A unicycle absolutely would be on that list.
Okay. So another one of the questions that came in is, of all the rights listed, abortion, sterilization, infertility care, et cetera, which ones would taxpayers pay for?
I believe it's all of them.
All of it, yeah. Can't
The
discriminate.
reason is that so taxpayers wouldn't pay for an abortion for an upper middle class woman, right? But they would pay for an abortion for a Medicaid beneficiary. So somebody who is 33, doesn't have enough income to get over the Medicaid threshold limits. I think it's 1 1/3 times the poverty limit, if I recall vaguely, not my department. But so for that woman, this is a fundamental right, and it would fall under the medical provisions because it is a medical necessity according to this. It's a fundamental right. So although some of these are elective, right? These are elective, I think that calling them fundamental rights pushes them up into the realm of taxpayer funded.
And it says that the state shall not discriminate. So they can't discriminate and say, oh, we can't fund this with taxes so that will be discriminating for abortion. So.
Okay, just a couple more because we're on a time budget.
Yep.
One came in before this started. Another question was, and you mentioned it, that a person, because if they're deemed a mental situation, they could have an abortion up to the last day. Does that include partial birth
Yes.
abortions?
Yes.
And can you explain, I know we're in church, but can you explain what a partial birth abortion is?
Yes.
God knows.
So abortions are different depending on the amount of weeks of pregnancy. So women that is pregnant in the first trimester is up to like 12 weeks, less than 13 weeks. Usually they get the abortion pill. So usually they give them a pill that is anti-progesterone, cuts the nourishment of the baby. Then the day after, they have to take a second medication that causes contraction and expels the baby. So she has essentially a labor of a dead baby at home or wherever she is. That's what abortion pill is, okay? Women that regret it could take high doses of progesterone and reverse it. So for those of you that may hear of a woman that regrets it after taking the first pill, there are some providers, like me, that can give high doses of progesterone to counteract the first medication that is an anti-progesterone medication, and you can overload the receptors to allow the pregnancy to continue and cover all the receptors with progesterone, and you take it for the first trimester, and you can save babies. They have saved over 200 babies doing this protocol. So it's fascinating that we have that. So that's the first trimester. Second trimester goes from 13 weeks to 27 weeks, and usually the procedure is just terrible. They use saline, or they could use digoxin, which is a medication that is injected into the heart of the baby, and they can cause a heart attack and stop it. Or they can use saline and inject it. They use this sometimes in multiple pregnancies, especially in vitro fertilization, if there's more than one baby that is conceived. Let's say they implanted 3 babies and the 3 of them are there, and the mom only wanted one. they recommend what is called selective reduction, and they can go and kill the other twin or two or three if they just wanted one baby. And what they do is that they inject the heart of the baby, digoxin, they cause a heart attack, the baby dies in utero, and the baby stays there until delivery, basically. There's a risk for the other babies to die. But this can be done during second trimester, and what they do is they use suction, they pull pieces of the baby, basically. So they pull arms and legs, and then they count all the parts of the body to make sure they remove everything, including placental tissue, because if they leave something in there, the mother is at risk of an infection. She could have sepsis, and she can die. Okay, she could get septic from leaving parts of the baby in utero. And sometimes they do botch abortions, and they have to go back to the clinic, and they have to remove the rest of it. It happens. So they use medication to dilate the cervix, get the baby out, and they have like a knife at the end of the suction sometimes, so I cut the pieces, and the baby does not receive anesthesia. They're using an ultrasound to look where the baby is and just pulling the baby out. And they don't let the mom see the baby. Obviously, they know that they've killed the baby when the heartbeat stops. Sometimes it doesn't work. And so anyway, that's second trimester. Third trimester, the baby is so big, it's hard to do that. It's not like you can suction the baby with a cannula. Sometimes the baby's so small, the baby can't fit in the cannula, but sometimes it's just pieces of arms and legs that they pull out. When the baby is too big, they essentially induce labor, and they do a partial delivery, legs, arms out, and they cut the neck. So they kill the baby before the head comes out. Or they destroy the brain, cut, suction, whatever they decide to do. And then the rest of the baby comes out. And that's infanticide, right? That is horrible. But that's a partial birth abortion when you deliver almost the whole baby and then you kill the baby before the baby is completely out.
Again, without anesthesia.
Yeah.
So we have quite a few more questions, but I'm going to go through them and kind of sort them because many of them are duplicates. We're going to take a break right here and have April come on up. And April is going to talk to all of us about spoiling your ballot, that you can do this, how you can do it. She's only going to talk for about 2.5 hours, and just kidding. So I'll go through these while you do your thing, okay?
All right, so what does spoiling a ballot mean? Officially, it means that your ballot is marked invalid and it's not counted by the election officials. There are several reasons that you might need to or want to do this, but after this evening or hearing more information, the reason we're focusing on tonight might be because you've changed your mind, or you thought that by supporting Proposal 3 it meant this and it actually means that, and you want to change your vote. So if that's the case, why do you do that, or how do you do that? You don't want to throw away the ballot because they all need to be accounted for, but what you could do is go to your city or your township clerk. That's probably the easiest and simplest way. There will be some form of a written request to spoil your ballot. It is different for every city and township, so unfortunately I don't know what that would be for everybody. I would encourage you to either call them, or if you have access to your internet, look on their website to see what they might require. They will ask you if you want it mailed or if you will be picking it up. We are on a time crunch, so if you want it mailed to you, it's something I would encourage you to do if you've already submitted your ballot. You want to get that request in because they have to process it and then get you a new ballot. Okay, if you have already turned it in, it's already been dropped off or turned in at the clerk's office, you have until 4 p.m. on Monday, November 7th. Actually, no, if you've not turned it in, if you have it in your hand, I'm sorry. If you have it in your hand, you have until 4 p.m. on Monday to get it turned in if you go in person. So that's the night before the election. That's if you have it. Or the other option is to take it to the polls with you, and you can surrender it right there to your election worker at your precinct. So that's if you have the ballot, turn it in the night before by 4 o'clock, or take it with you that day. They will have you sign something saying that you want this to be your new ballot. If you've already mailed it in, you have to submit it by mail by Friday before, so that would be November 4th at 5 o'clock. Or you can go in person the Monday before by 10 a.m. So if you've already turned it in, you have a little bit of a smaller window. If you have lost it, I really encourage you to call your city clerk and find out if they have it. If you have people that help you that might have turned it in and it was mailed and you didn't realize that, I really encourage you to find out if your clerk has it. Because if you think it's lost and you wait and you show up at the poll to vote that day, when you give them your ID, they're going to pull you up in the system and it's going to tell them that an absentee ballot was sent and an absentee ballot was received. And at that point, it is too late. So if you have any suspicion whatsoever that that ballot might be turned into the clerk, I really encourage you to call them. There is a Michigan, it's called the Michigan Voter Information Center, and it's mvic.sos. It's through the Secretary of State. You can check your ballot, but it's even easier to just call them and ask them. You don't want to wait, because if you do, there's nothing they can do at that point. So there's a lot more information if you're interested. I'm still learning about it, but I'd be happy to answer questions or try to get you in the right direction or to the right person. But if you voted already and you voted for this proposal and you've decided hopefully that it's not something you want to pass, then I really encourage you to spoil your ballot. And if somebody else tells you they've done that, then tell them to call the city clerk, and they should be able to help them with everything. So.
Great.
Ready?
Yes. Okay, we have a lot of questions here. A lot of them are very similar. So in terms of time, unless you have some last minute before I go into these, I'd like to show the video. Can we show the video? Where's my smart guys?
Maybe throw us a question while they're firing it
Yeah,
up.
I can do that.
Oh,
So
there's the video.
Oh, here it comes.
how will the...
Hold on. They've got it.
Starting? Okay.
Yeah. Here, we should probably turn these on.
Maybe not. I don't know what happened. They had it there. Okay, there it is.
Bring this home as we really prepare ourselves for 14 weeks to that moving forward. At this point, I'd like to introduce
I will ask a question, and so that, I'll move this for you.
I knocked it down on purpose.
I know you did.
There you go. Thank you.
There's quite a few of them here. It says, you know, two things. What are the, actually it's a three-point question. Ever since Roe versus Wade, what is currently going on in Michigan right now? One. Number two is, if this doesn't pass. Okay.
Video can wait. All right.
Yeah.
So number two.
Because you can probably answer them all, right? So number one, what is going on right now since Roe versus Wade's been overturned in Michigan? Two,
Got it.
what would happen if it is voted down? What would happen to the abortion laws then? And three, if it is not, or if it is passed, will doctors have their discretion, whether they're Catholic or against it or whatever, will they be forced to give abortions?
Got it. So the easy one is number three. Will doctors be forced to perform abortions? You can't force anyone to do an abortion, but you can pull their license. You can pull their credentialing at a hospital. You can pull their ability to practice medicine, period. All of those things we understand will happen because this is a fundamental right that shall not be discriminated against, and we think that it applies in such a way, it wouldn't, I as an attorney not practicing in this area, can't guarantee any of these terrible, awful eventualities, but I do think that at a minimum, it would change the way that a particular physician could or could not practice with Medicaid system, could or could not practice with the Medicare system, could or could not practice with regard to specific insurances. It's seen in other areas of medicine that, you know, for instance, the OB group, the National OB group,
American College of Obstetrics and Gynecology
is pulling credentialing for anyone who's speaking out against Prop 3.
against abortion. So they, which I guess it will include Prop 3. So if there's any pro-life OBGYN, they're the most attacked by the devil out of all the doctors from what I have seen personally. And, right, because the devil does not want that. But the American College of Obstetrics and Gynecology is the group that provides the board certification for gynecologists, and they are saying that obstetric and gynecology specialists that are not on board with the abortion agenda could have their certification removed. Basically, they're not going to be accredited, certified, board certified, which is something that we work our whole life for, right? I'm a board certified family medicine physician, and you have to be recertified every 7 or every 10 years. You have to keep up with CME. Like, for example, we do 150 CMEs every 2 years, practice improvement projects. And like, it requires so much time and effort on top of seeing patients, and it basically means that you are qualified in your profession, that you are practicing good evidence-based medicine to provide high-quality care for patients. And this organization is saying, whoever is not on board with this, we can take their certification. So that's what Dan is talking about.
Yeah, and so I think there's going to be high-level persecution of faithful physicians and low-level persecution of faithful physicians. I think that's a low-level persecution. High-level persecution is you cannot be an internist in any hospital in Michigan that receives Medicaid funding if you are not willing to perform abortions. So
Maybe OB.
an OB, not an internist, sorry. So that kind of scary stuff, yeah. So that was number 3. Number 2 and number 1 are very related. So where are we now? What happens if it doesn't pass? Where are we now is Roe v. Wade and Planned Parenthood v. Casey have been overturned, okay? But that doesn't mean that abortion is now illegal, right? All those cases mean, all the new case, Dobbs means, is that the states decide, okay? And some states have gone off the deep end, right?
California, New York.
California, New York, but they haven't gone this far off the deep end, all right? This is the farthest off the deep end that you can possibly go, as far as I can see, all right? So where are we now in Michigan? Is we have a law that was from the 1800s, reworked in 1931, on the books in 1973, and then determined unconstitutional by the federal courts, but never removed from the books, okay? So that 1931 law says that you cannot induce a miscarriage unless it is for the saving the life of the mother, okay? And it applies from, as far as I can tell, from conception until birth, okay? So, what has happened?
For abortion.
Okay.
So sorry, just to clarify. So miscarriage is not the same as abortion. Okay, so miscarriage is like a spontaneous abortion. The baby dies in utero. You're not trying to kill the baby. We use the term miscarriage when the pregnancy ends naturally before 20 weeks. If it's at 20 weeks or more, we call it stillbirth. We also use the term stillbirth for babies that die in the process of birth. So miscarriage, stillbirth, same thing. What differentiates is the number of weeks babies die in utero naturally. So they can call it an abortion in the sense that it's spontaneous end of the life of the baby, but it's not the same as an elective or induced abortion, which is how we usually use the term abortion just in general jargon. So with
Thank you for that.
yeah, so this law, when it talks about miscarriage or abortion, means they are allowed as long as it is to save the life of the mother. And if not, the physician can be prosecuted. That's what that law says. So not the patient, the physician that does an abortion that is not necessarily to save the life of the mom will be the one prosecuted.
Right. So what has happened is that the pro-abortion activists have gotten a court case together. They've filed in the Court of Claims, and a Court of Claims judge, one judge, who was also previously an attorney for Planned Parenthood, okay, just an aside, a jab. She has decided in a 40-page opinion, no, abortion is still legal in Michigan. This 1931 violates our Michigan Constitution enacted in 1963. How she can say that, I don't know. Read the opinion if you feel like reading 40 pages of garbage. But that's the current status of the law, that the 1931 law is on hold.
It's not active.
Not active, okay? That case is working its way through the courts and will eventually reach the Supreme Court in Michigan. The Supreme Court in Michigan is currently 5-2, in my opinion, pro-abortion rights activists.
So 5 in favor of abortion.
It's extremely unlikely that Michigan will return to a 1931 or pre-Roe framework. Extremely unlikely. Unless there's a subsequent legislative fix, which we should move for, talk to your legislators, unless there's a subsequent proposal in the 2024 cycle, which you should think about getting involved in, okay? Because I don't think that our legislators have the stomach for it, especially since almost none of them have spoken out against Prop 3. It's crazy to me, but they just aren't on the stump talking about Prop 3. And, you know, we don't watch TV commercials, but I just haven't seen them out there. So if you want to do something now, talk to your legislators, you know, get them active on this because it's crazy. So that is where we are now. abortion's still legal, Planned Parenthood's still functioning, everything's going along smoothly. If this does not pass, that case will work its way through the Supreme Court in Michigan.
Favor of abortion. Anyway.
Will probably rule in favor and will probably put some sort of parameter on when the state can and cannot regulate. We will probably be in a Roe and Casey framework in Michigan until the legislature acts again. Okay?
Now, I think you should mention what would have been ideal from the Supreme Court at the federal level to do instead of overturning Roe versus Wade, because I think that is important in Michigan.
I am not a federal practitioner. My wife and I have had a private conversation about this, and she's egging me on. She hasn't done this in previous discussions that we've had in front of people, but here we are. My wife will do this from time to time, as you gentlemen may know. So I think I think Dobbs was wrongly decided. Ooh, silence, right? I think Dobbs was wrongly decided. I think that what should have happened is that the Dobbs court should have said that children in utero have a right to life. Instead, what Dobbs said is, at the founding of America, the states regulated abortion, and therefore the federal government is not going to step in and regulate abortion through the Constitution. I think that, over the course of the development of science and the development of this country's constitutional framework, we can recognize life when we see it. This child is alive. It's troubling for me because you have all these states that have gone off the deep end, not as far as Michigan's about to go, but they're killing people willy-nilly, and I think that's unconstitutional. So, at the federal level.
Great answers. Really appreciate it.
Yeah.
We have other questions. I know some of you have turned them in, and out of fairness, I know there's a few people in here that ask me, how long will this go? I've got to be somewhere. So in fairness, I'm going to wrap up, but if you have questions still that weren't answered, because we're over quite a bit in our time, and this is such an important topic, I hate to, stop, but we've got to do that for some of the people here. So, with that being said, are you two available to stand in the vestibule and answer a few questions afterwards?
Sure, absolutely.
One thing that I will want to say before we wrap up, I don't know if anyone has a question about ectopic pregnancies.
That is on there.
Okay.
Yes.
So ectopic pregnancy, just quickly, is when the baby is not in utero, is outside of the utero. Most common place, the fallopian tube, even though it could be in other places, like a scar from a C-section, abdominal cavity, somewhere else. And the baby is going to die no matter what, because that area is not capable of expanding to allow the baby to grow to a natural size. And there's no technology right now in medicine to be able to transplant the baby from the fallopian tube into the utero to be able to continue through the pregnancy. So no matter what we do, the baby is going to die. If we don't take the baby out, the mother is going to die because the area is going to rupture and it's going to bleed, and something's going to have to be done to stop the bleeding, which is surgery. And if we don't take the baby out, the mother's going to bleed to death at some point. So the management of an ectopic pregnancy is usually dependent on the number of weeks of the baby. Usually ectopic pregnancy is like 1% to 2% of all pregnancies. So it's really a very low percentage to begin with. And about 40% of them are misdiagnosed because if you recheck maybe in a few days or a week, the baby may be moved to the utero. So, and why do I say this? We have more advanced ultrasound machines, and if you see the baby very early on, the baby might still not be in the place where it's going to end up. So the ovaries, fimbria, fallopian tubes, right? The egg has to travel from the ovary, the fimbria grabs it, goes into the tube. That's what the sperm meets the egg, is in the fallopian tube. And that there's cilia that has to work and move that egg, fertilized, that is now a zygote, all the way to the uterus. And if that doesn't happen, or if there's a problem in that process, the baby can get stuck in there. If the baby is small enough, and it's not done all the way traveling, if you recheck, maybe in utero. If the mom is not having symptoms, then you can watch and wait depending on how early she is. If the mother is having pain, abdominal pain, pelvic pain, is having bleeding, then it's more of an emergency. So she needs to have surgery. The ideal way, so there's different approaches to it. If the baby has a heartbeat, you don't want to give abortifacients to the mom to kill the baby and expel the baby like you will do with an abortion bill as a Catholic physician. Can it be done? Yes, it can be done. What you could do surgery and remove the tubes and cut on both ends and remove the baby rather than attacking the baby. So you see here where the ethical part and the intention is to not attack the baby. Remove the baby, save the life of the mother. If the baby has died in utero, there's no heartbeat, it's past 6 weeks, 7 weeks, 8 weeks, the baby should have a heartbeat by then what you could do, you could potentially give medications to have an induced labor, or the same medications that you will give to induce an early miscarriage, to have the baby pass, to help the mom pass the baby, even though the baby has already died. So the treatment depends on the number of weeks, how stable is the mom, how quickly can she get care if she has pain or is bleeding, and get to the hospital to have surgery if she needs to. There is medical care for ectopic pregnancy. Women are always going to receive care for an ectopic pregnancy. We do not need this amendment for ectopic pregnancy care. It's a medical emergency. It's to save the life of the mom. They go to the hospital. They're taken care of for this purpose, depending on the stage, the mother's status, and the baby. So I just want to know this is not an induced elective abortion like some people may want to make it look like. So it is one of those lies.
Thank you.
You're
That was one of the questions too. So again, the questions that weren't answered, Daniel and Joanna was so kind to be here tonight, and we really want to thank you for that. You can talk to them in the vestibule. So we hope that Proposal 3, some of the questions that have been floating around out there have been answered, and you learned enough that you can go out and, spread the word. Spread the word on these. This information is just, it's atrocious. This bill is atrocious. So spread the word on what these two professionals have told you. Take the document with you, the document that we handed out. There's also yard signs, and feel free to take them, and we have more coming this coming Wednesday for the next one. So put those out there, and then there is a table out there with a whole bunch of different documents that we encourage you to take. This one here, it says this is too confusing, too extreme. It's got 4 boxes, and it is a great little document to give to somebody who says, I'm pro-choice. And then you can say, well, just, if we could have a civil conversation, just answer these questions and think about it. That way you don't have to get into that, well, I'm pro-life, you're pro-choice. These are very, very good questions that pertain to Proposal 3.
I think it's a more objective tool. It's like,
Yes.
do you not want physicians to do abortions? Yes or no? And then it says if you check off no to any of these, then vote no. So it's a more objective way of them saying, like, maybe I want physicians to
Absolutely.
make
So
abortions.
please take that and share this stuff. I want to thank our guest speakers, Daniel and Joanna.
Thank you.
I also want to thank the ushers and all the video group, office personnel, and the entire team that made this happen. I want to shout out to Judy Hendricks for leading this project. She's not here tonight. But most of all, I want to thank all of you for your attendance.
Yeah.
This is such an important topic, and I hope the time was well spent and that you're comfortable now going out and telling other folks and explaining to them why we need to vote no on Proposal 3.
And maybe in 2 years, we can have an amendment to a constitution that say life, the fundamental right, starts in utero.
So thank you all for coming. Thank you all for what you're doing in your individual lives, and to make this not a reality in Michigan. Joanne and I are not being paid to stump for this. We have, lives completely separate. Your pastor tried to give us something for this, and we told him to put it in your bin. So we love our kids, and that's why we're here, right?
We love the Lord.
We love the Lord, and we're trying to follow the promptings of the Holy Spirit, and I would encourage you to pray the same simple prayer: Lord, what am I not doing today that I should be doing? Yeah. And you wait in silence with that. So with that, I'd like to close in a prayer, if you don't mind.
And what should I be doing in this project? Because this pews could have been filled with people, but you are here for a reason. The Lord has chosen you to be here, to listen to all this information, and you have power and knowledge. And some people are out there that have not heard any of these, or some of these, and they need to hear you. So if you feel called to go door knocking, talk to a coworker or family member, do it. Because when November 9 comes, God forbid this thing will pass, you might say, was there anything that I should have done that I didn't do? This is the time to act. Okay, we have to come together for all those lives that could be lost, because we have already lost over 63 million people that are not here today because of Roe, plus all the babies lost in vitro, and the Plan B pill, the day after pill. I mean, we're talking about 70 to 80 million persons that are not here today. One day, I need to tell this story. St. Padre Pio one day went to confess a woman. And the woman, he told the woman, close your eyes and tell me what you see. And she said, I see a plaza full of people. I see priests, I see a solemn procession, and I see a pope that is about to take the throne. And Father Pio said, that was the baby that you aborted. That baby was going to be a pope.
So, just two other statistics too. Those numbers you just said, that's like taking the whole state of Texas and every single person in it and the whole state of New York and wiping them off the map. That's how many people, how many children, how many have been aborted. And so there's also another statistic out there that when people go to vote, that over 50% of them will never hear any of this. They will see Proposal 3 as it is when they go to the ballot. And that kind of scares me, because you've read it, and there's a lot more to it. So thank you all. Thank you.
Thank you. Have a good night. God bless you.
We're going to close in a prayer. If you wouldn't mind, Father, leading us in Our Father, Hail Mary, and Glory be. I'm going to lead the prayer, Father says. All right. So, dearest Mother Mary, we entrust this project to you. We ask you to cover us in your mantle. The whole Flint area in particular. Please invite us to love your Son more. Hail Mary, full of grace, the Lord is with thee. Blessed art thou among women, and blessed is the fruit of thy womb, Jesus. Holy Mary, Mother of God, pray for us sinners, now and at the hour of our death. Amen. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from the evil one.
Thank you, everybody.
Glory be to the Father, and to the Son, and to the Holy Spirit, as it was in the beginning, is now, and ever shall be, world without end. Amen.
Okay. We're going to have to ask Father to get up and do a mass.